gavel has hit my
No.
desk. Joe, you have a,
Yeah, before you call the meeting to order, though, let me just wait, and I got to get confirmation that Cheryl
okay.
is able to hear for taking the minutes, so just stand by for a second. Okay, we're all set. She's on.
Okay.
All right. You want to call the meeting to order, Juanita?
Okay, I will officially call the meeting to order at 18:05.
Okay, so before we get started, and we got a lot to get to and cover, I just want to let you know there are other people on the line which we have not had before, given the fact of the governor's COVID regulations that you say we don't have to during these times have public participation. And not that I'm adverse for that, and I certainly don't mind anybody who wants to listen in. However, it would have been nice to know that this was going to happen other than within the last 2 hours, just because it's, you know, when you have other people besides what we know who we're going to be talking to, if there's any questions that come up, it'd be nice to be prepared or in a place to be prepared. I'm at home right now. If I thought there was going to be people on the line that might have other questions, I would probably be in my office. So welcome to everybody who's here. What we're going to do is we're going to get right to the agenda. Given the fact that there are no action items on the agenda, in other words, anything for the board to vote on, we're going to move public participation to the second agenda item, and where we're going to cover all of our COVID conversation first. Two things about that. First of all, if anybody does have questions when we get done discussing the COVID issues that we need to, A, hopefully questions will be answered before they even need to be asked, and B, you know, it'll just allow for us to quickly get through what we need to talk about. Now, backtrack a little. If there were any agenda items that were a action item for the board, in other words, one that they would need to vote on, that would be influenced by public participation, of course, we would do public participation first. So with that, we'll get right to the, actually, you want to do the minutes?
I was just going to say that.
Do the minutes first.
Okay, I make a motion to approve the minutes from the last meeting, December 11th, I believe.
I second.
All in favor?
Aye.
Aye.
Okay, good. So we're going to give an update. Now, I know that, and I don't know exactly who's calling in or who's on the line. The information was put out there to, I don't know if it was the public, I don't know if it was just counselors, and I don't need to know that. All I need to know is that it kind of diverts the course of the meeting in the sense that if I know that there's people on here who are seeking information that they wouldn't otherwise have gotten, then I'm going to give that information right now, even though it's already been given out to the city council and also the mayor and the board of health. You all got that email that I sent yesterday. So, but again, not knowing, yes. Well, it's okay. I mean, no, it's all right, because if there's even just one person who's a member of the public or listening at home, it could be on TV to try and get information from this meeting as their source, then I'll just go through it. It might be redundant for some, but it may be new for others. And I know, I apologize to the counselors, this is already something that you've been notified of, and the board as well. But let's go through it for any members of the public that may be tuning in specifically to obtain this information. And so I'll start with the COVID-19 vaccine. That's been a big topic that we have had inundated with calls on that. Counselors have been inundated with calls on that. And so the only reason why nothing had been said so far was because we had no information to give. We've been given nothing even to this date from the governor or the State Department of Public Health about how, when, and where vaccinations are going to take place when we get past phase 1, which we are in phase 1 right now. Phase 1 consists of the frontline healthcare workers who are COVID-facing direct contact care people, long-term care facilities, and also right now this week, actually today and tomorrow, I think, we're doing the first responders for Westfield, police and fire, and dispatch. So that is where we are currently. Phase 1 will not be complete until we circle back around and vaccinate other healthcare workers or congregate care settings. And once those are all complete and they have their first dose, then we move on to phase 2, which is scheduled to be February. And I can only say February. The state has been cryptic in giving the information, and intentionally so, and not to anybody's dismay, but they don't have all the information that they need to disseminate right now either, because it depends on supply. It depends on what the administration decides to do, which, as you may or may not know, since I wrote that email last night, the administration has decided to open up more vaccine, to dispense more vaccine, to get it out to the states so that they can do the second round, make sure that all the people in phase 1 get their second dose, and that we start getting it into the arms of seniors, which is very important. So, as we said all along, the process and the whole situation is very fluid and ever changing day to day. That's a new thing now that that then kind of influences the timeline. And the worst thing that you can do is worse than not putting out any information is putting out wrong information that you then need to retract. So in the paper today, I did an article. I called the newspaper yesterday and asked them to put out the information that I'm currently discussing with you all, and so that it can get out to the public. But the message essentially was, we still don't know. So please be patient. We will get this out on all platforms when it becomes available to us, and we will give plenty of time for people to prepare, clear their schedules, make sure they're available for when they need to be vaccinated. But the other article in the paper right next to the one that I talked to the news about was the governor saying that, clearly admitting that he's not giving out information ahead of time to municipalities because the changes that could be made between now and 3 weeks from now are huge. He was talking about public information going out in a 2 to 3 day before the actual events will occur. Now, of course, we'll know before that, but the general public announcement, he doesn't want to do too far ahead of time. So at no point during this should we expect to know what's going to happen 2 weeks from now. That's not what he has decided to do. So that being said, phase 2, again, that's slated for February, which then will be the time where we really focus on the seniors. Of priority is the 75 plus, the 65-year-olds with one comorbidity, or people with 2 or more comorbidities that we'll try and do in phase 2, and also the essential workers, so that we can still have our trash picked up and things like that. Phase 3 tentatively set to start in April for the general public. So that'll be at the time where we really are going to have to see how it's going to play out as far as who is handing out the vaccine. We don't know as a health department if we're even going to get any. It may very well be a mass vaccination clinic that's done through the state. For example, at a location such as the Big E. I'm a very big advocate, and we will get on this tomorrow. Deborah and I have spoken about having one of the mass distribution facilities be in Westfield, so that we can serve our residents and also the hill towns and other areas, points west, that need that service. And I have been in contact with Kelly Pease. He offered his assistance to put the bug in the air and to facilitate having a vaccination site, if it's run by the state, at Westfield State University, and they have already offered to host that. which would be very nice for the city because the state-run clinic would be being done on state-run property. So there's a lot less logistics and paperwork that need to be going back and forth. So it should be a seamless process if this happens. So that's what we're advocating for right now, to get it in Westfield. Nonetheless, again, it could very well be in phase 3 when it's available to the general public, or even phase 2 when it goes out to the seniors, that it could just be going out to primary care physicians' offices. It could be going to pharmacies. Again, it could be a max vaccination site run by the state. It could be regional distribution facilities that are, cohorts of different cities and towns, regional type situation. But as of right now, like I said, the Westfield Health Department has no idea if we're even going to be receiving vaccine. I would hope that at some point they'll recognize the need for not only in phase 2, the essential workers being vaccinated, probably better served locally, and city employees better served locally, so that we continue continuity of government and provide the service that the people need, so that we don't have to shut down City Hall to employees as well. It's bad enough we're close to the public. So that's where we're currently in phase 1. That's the projections moving ahead as we know right now. And so any questions from the board, or open up a discussion on this, and we can do that, or if not, we can move on. Let me know.
Well, Joe, one question I would have is, how are you are you at that point where you need to get volunteer nurses to administer this vaccine?
I can speak on that.
Okay.
It's Deborah.
Yes.
I did talk to our MRC today. Steve is the MRC director, about getting in volunteers in place, getting them vetted, making sure that if the vaccine comes, we're ready to roll with staff. Mm-hmm. And we discussed possible staffing sources, retired nurses, school nurses, different populations. And while I'm on this topic, Dr. Stremko, we did agree to receive the COVID vaccine, and we agreed, we signed that agreement to receive the vaccine if they do give us vaccine. I now today need your approval to enroll in our yearly enrollment, the vaccine enrollment for the state. I also have to be current on that to receive the vaccine, as well as any other vaccine. So I'm just asking for your permission to continue being a vaccine provider. If I have your okay, I can go ahead and do the electronic signature for that. Is that okay with you, Dr. Stremko?
Yeah, of course, Deb.
Okay.
Good. So yeah, we have had actually a lot of people reach out to us, people known to me even, that can function in a capacity of helping to administer the vaccine.
Excellent.
And they have also made it so that, EMTs can also help out. So if we needed to use some of our in-house people for that, I don't think that we'll be at a loss for people to actually shoot the vaccine. It's more of all of the other logistics of everything, with hosting such a large scale event. Again, I think that if I had to guess right now from the conversations that I'm hearing, it seems as though the first rollout in phase 2 is going to be a state-run mass vaccination facility in conjunction with the federal government. Unless our state feels like they can just do it themselves, the federal government has offered to help put that into place for state mass vaccination sites if they need it. So I think they're going to try that first, and again, getting it into our seniors is right now, after we get past all of the very essential people and getting it into the seniors who are most at high risk. is something that the state is also focusing on. So I think they're going to give it their best effort, and then everything else, once they get overwhelmed and sick of it, then they'll hand it off to us. Huh?
Right.
But I feel like right now, knowing what I know and what I've heard, that's the way it's going to go. But again, stay tuned. This, the reason for the communication to the council and also through the newspaper to get and this message and this meeting out to residents who are listening is to just let you know this is the first step in. We are going to continue to get information out. All right. So however that happens, I don't think I was ever really qualified to be the public information officer and spokesperson. However, if that's the way it turns out, that I'll you got to understand when we're in this and we're in the depths of everything that goes on every day. And again, the next thing I'll talk about is the nightmare week that we had this week with caseload. That you have to understand in the health department, we're nose to the grindstone. Very specific tasks to perform, very specific case investigations and contact tracing and conversations that we have to have every day, all day. And to pull away from that and have to then remember, oh yeah, now I also need to tell everybody else what's going on. That's not anything we've ever done. It's not anything I'm acclimated to do, but I certainly will. I will tell anybody who asks exactly what's going on. So, I'll try not to be remiss in getting the message out via email, especially to the city councilors, because I know their constituents are, they are sometimes the first line of questioning for their constituents. So I'll make sure I try and do that until maybe we get a better system in place. So any other questions, comments?
So Joe, do you think they'll use the Eastern States grounds like they are for the firefighters and first responders and just rule that over into a public for the rest of the vaccine administration?
Yeah, from what we've heard now, yes, it sounds like that's very possible that the Big E is going to be a site for mass distribution, hopefully run by the state, because I don't think West Springfield has any more resources than we do to handle that. And that makes it a little bit more challenging, even though that's very close for us and people can certainly get there easily. They manage to get there for the Big E when it's in session. So I would imagine they'll be able to get there for life-saving vaccination. But again, we do hear the complaints that, why is everybody else doing all of these things and Westfield's not doing it? So what they don't understand is that everything that's going on, and including testing, which we'll talk about after I go over our caseload right now, these things that are going on in other communities are not hosted primarily or exclusively by those communities. It's done through state funding or federal funding that was allocated for a long time ago. And there's lots of ins and outs of that, and why Westfield isn't doing it doesn't mean it's wrong. It just means that we decided to go in a different direction for what we felt was going to be more effective to control the spread. And I will stand up again with about that decision to anyone who wants to ask. And we will get into the testing conversation. So yeah, Juanita, there's going to be a big push at the eastern states. But again, I still feel like, for Points West and Westfield State University would be a great location. And then we don't have to take the criticism that, we're not doing enough for our residents, even though, we're all in this together regionally, state, especially Western Mass. And why any one community would be picked out as being deficient for doing something over another is really not fair to that community, in the sense that they may be doing something better than the other ones are. But so, and again, this isn't a cookie cutter situation. Not every city and town is the same. And I've said that before. Westfield has unique needs, and it's a unique city, and it's not like West Springfield. It's not like Chicopee. And it makes my skin crawl when we get that comparison. And I know that you have to answer questions about why are they doing it and we're not doing it. Well, if we're not doing it, it's for a very good reason. It's not an oversight. So, you know, maybe for other departments or other areas in the city, that could be the case, but we'll talk about that more later. So anything else on the COVID vaccine?
It just sounds like you're responding to getting a lot of criticism. And once again, I know I can speak for the whole board. We know how hard you guys as a department are working, and we're extremely proud of you. And we back up all your decisions thus far and the work you're doing.
I agree
Thanks.
with
I mean-
Juanita, and I want to say, having worked there, I certainly know the limits of the staff that you have. You have 7 staff members. How you're doing what you're doing is just beyond belief. And I think that people need to realize how few staff members are in your department, and to carry the weight of this whole pandemic is amazing that you're still talking about it. So we're
Yeah,
very proud of you.
To echo what Juanita and Margaret said, Joe, you know, inside baseball, but we know that a department of your size was never set up to referee a global pandemic at the local level, and yet you're doing it, and you're doing a great job. So keep it up.
Thank you. And, you know, I keep saying, and kind of in jest a little bit, but believe it or not, there is still other health department work that needs to be done in the community. Life doesn't stop because of COVID. Other health problems don't stop because of COVID. And so not only are we dealing with that, but we're dealing with the other issues as well, as we always have. And thank you all for your support. Again, I really, and the city council too, they've been great. We have their unyielding support. You know, the criticism comes from the uninformed, and that's not something that I want to continue. So, you know, the mentality of, you know, the city's not doing enough or the city's not prepared is just not true. And I will prove that. And of course we have so far. So thank you all for that. And I think that in that light, I guess I'll go right into, if you haven't seen yet, I reported out today again another record number of new COVID cases. It's the first time we've ever gone over 200 in 1 week. We are at 247 active cases.
Yikes.
Try and figure out how you do that with 2 nurses and a contact tracer. And we had 2 new deaths this week, unfortunately, COVID related, as opposed to last week where we had none. We also have a new record high, 293 of our residents that are currently in isolation. Almost 300 people are in isolation with COVID, and 247 new cases came up this week. Last week, we set a record at 173 cases. This week, we're at 247. That in conjunction with trying to segue into dispensing vaccine or getting ready to deploy our plan that we have had in place for several years, dozens of years. Okay. Deborah and I have been working on emergency dispensing site plans for over 20 years. Mm-hmm. This isn't anything. Nobody in public health, unless you have your head in the sand, we all knew this was going to happen at some point. You can't think that in this world there's not going to be another epidemic or a pandemic. This was inevitable. Unfortunately, it came in our tenure, and so we well, maybe fortunately it came in our tenure because we have a lot of years of experience between Deborah and myself, and the rest of the staff has acclimated quite well. But again, record number of cases this week. What do you want to attribute that to? Is whatever you desire. You know, I don't really care. It doesn't matter. The fact is, it could be more frequent testing, more people getting tested. It could be more people getting COVID. It could be an exponential factor of gatherings at Christmas and New Year's. That's my theory. And until this dies back down again, we have no choice but, to keep trying to do the best we can to stop the spread. And it's a almost impossible mission. There isn't a day that goes by that, once we get through all of the nitty gritty and try and settle down for a minute and take a breath, that Deborah and I look at each other and just say, well, we can't win. You just can't win. And that's the virus in and of itself. So, but on the other hand, the schools are doing okay.
That's good.
I mean, they're closed, but there's a whole nother plan about that, which I won't get into because it wouldn't be fair to school committee who meets tomorrow night. I'll be on there with them to talk about proposals and plans and recommendations. So stay tuned for that one. But we're now, if you would have said to me back in March and April that it would have gotten worse at the end than it did in the beginning, I would have said, open the window so I can jump out right now. But the reality is it has gotten worse. It continues to get worse. And we're doing all we can. So I'm such the doom and gloom lately. I can't wait until I can report to you guys something happy, like we saved the world from radon or something.
Radon.
I mean, that's another thing.
But you'll have saved humanity from COVID to some extent.
Well, you do the best you can, and you really try and pull these cases out expeditiously so that, there's not that continued exposure. But, when you get 240 cases in a week, you're spinning your wheels at some point, unfortunately. But we do have the state contact tracing collaborative. And I think, Deborah, would be a good time for you to opine if there's anything you want to say about our current workload or not.
I could say that we're really delving into business. The businesses, a lot of them before hadn't seen any clusters of cases. So we're spending the time to really review with them what isolation and quarantine is. The guidance has changed since we surged in March, and some of them weren't aware of that. And so we're trying to be a resource because we can't solve this one case at a time. We have to do the big picture and make sure that our partners, our schools, which have been great, our businesses all have the information they need and have a resource when they have cases to figure out how we're going to contain it so it doesn't explode exponentially in the businesses and the schools and the daycares. So that's kind of a new way we're heading right now. The contact tracers are helping us with the individual cases so that we're able to focus more on the big picture and contain that way. And that seems to be helping. Even though we have a lot of cases and it doesn't appear that way, I think it would be worse if we weren't doing that. So, and the businesses have been great. Our schools have been great. Everybody's been very receptive to working with us. So that's what I have for update.
Okay, good. Thank you. So that's where we're at. And if there's nothing else, if you guys don't have any other concerns or questions, we can move on to the next hot topic of the day. Although I think this has waned a little bit from the initial surge of outrage of why we're not testing. Why aren't we testing everybody in Westfield for free? Why does West Springfield get to do it? Why does Chicopee get to do it? Why does all of these other towns testing their residents for free? And I'm going to say the background of the actual logistics of it, and then I will leave it to the medical experts to weigh in on what their opinions are of testing. I won't skew with any remark, but of testing for the general public. All right. So first of all, the communities that are doing testing for their residents it is not free. It's free to the resident. It costs the municipality $50,000 a day.
Oh,
$50,000 a day
oh,
to test people for the sake of testing people. That comes from CARES Act money. We have CARES Act money. CARES Act money has been allowed to be transferred over to be used in this calendar year. $50,000 a day to test people, where in my opinion, testing is available for people who need testing, is a huge price tag. And I'll tell you why. $50,000 is CARES Act money. You as a municipality get allocated a certain amount of money from CARES Act. Say for Westfield's purposes, it's $3.2 million. You get that. You don't want to leave money on the table. And you usually can find a way to use that $3.2 million for COVID response. But that's our money. That's our money. When we get it and it's in our hands, it's our money. And when it's gone, it's gone. And we got a long road, folks, until we get to the end of this thing. And I will go on the record to say, I, for one, will not be the guy that's going to advocate to spend $50,000 a day on testing of our money when we may very well need it for vaccinations. Again, I believe that testing is available. No, I know testing is available for everybody who needs it. $50,000 a day is outrageous. Somebody's getting rich off this, and it's not the city. If there was a need for testing, we would know there was a need for testing. We get 0 phone calls at the health department that people can't get tested. I'm sorry if you don't want to wait 2 hours. I'm sorry if you have to wait a couple days until you get in to see your PCP. But the fact of the matter is, when this money could go a long, long way in getting all of our residents vaccinated and we can solve this problem, I'm not going to advocate for $50,000 to be spent. Now, there's other consequences about random testing and excessive testing. And for that, I'll turn it over to the board
So
to give your perspective.
So I completely second what Joe said, that I think it is a waste of money and energy for the city to consider that kind of testing. There is, as he said, readily available a lot of resources for testing. There's Noble, there's Urgent Cares, there's Eastfield Mall, there's HCC. And if you Google it, the list just goes on and on of sites in Western Mass that are easily accessible. And first and foremost, call your primary care and they can order it for you at the site. My second part of it is, I know firsthand, I work in a facility in Connecticut that does testing, and within an 8-hour period, I've seen 50 patients, and most of those are seeking tests. Few of them are sick, most of them are tests. And a lot of those people are looking for tests for the wrong reason. It's the third or fourth time I've seen them. They think that if they have a test, then they can go to a party night, or they can go visit somebody, or they can do this, or they're trying to get tests that say they're negative so they can go back to work, even if they had an exposure the day before. Or they're coming in thinking that they had an exposure today, so they need a test today to prove they don't have it. And the timing of tests is crucial for the period of incubation and when you're exposed. So we have a huge responsibility to stop this spread. And as a department, and as Stan will, I'm sure, second also, it's our provider's responsibility to guide that decision of when the test should be done. And if we're giving people a false sense of security by giving them a negative test that was done at the wrong time or for the wrong purpose, then we are just as guilty as somebody walking around without a mask on and helping to spread rather than stop it. So city testing, I don't think is anything that we need to be doing in our community.
Yeah, I'll say, unlike last spring, when clearly testing was a rate limiting step in the whole process of fighting COVID, it's not my perception on a professional level or personal level that testing is a roadblock or a problem now. And I don't think that ought to be the focus of the department. So I agree with Juanita.
And I agree with you both.
And the other thing too that I think is
on this subject if you want.
well, we may need to do that, but we can save that. We have 5 minutes until I want to get to public participation. If anybody has any questions, so we can give that full 15 minutes of time to the people who are on the line. But the last thing I'll say about it is short-sightedness as far as testing. So when you get tested for COVID, until you get your results, you are to quarantine. If you can't do that until you get your negative test result back, what's the point? You could get a positive test result back and be asymptomatic and be out there in the world as that scary person that we're all worried about, right? The asymptomatic super spreader. You need to abide by what the regulations are. You get a test, you are home, you're quarantined until you get the results. If you're not willing to do that, save your time. You know, right? So people don't think of that. You don't just get a test and get to tra-la-la around in the world and do whatever you want. It's not the way it works. So
that test is a snapshot in time of that moment. So if you leave and go to the grocery store, you could have been exposed at the grocery store and that test is meaningless.
And again, I'll go back to saying what I said before, and I'm sorry if people don't like it, and I'll be the bad guy, okay? I mean, look it. Again, Westfield is a different animal. We obviously, as anybody can see from this conversation, there is expertise, there is accountability, there is responsibility, we're looking at this analytically. This isn't just, let's just go ahead and do this so people stop calling us and yelling that, we're not giving free tests. I mean, that we can't succumb to that pressure, not ethically or politically, knowing what we know and knowing what you guys have just said. So we need to end that conversation. But again, anybody that wants to know, if you have questions, you want to be outraged about why we're not doing it, 572-6210, call the health department. I'll explain it ad nauseum.
Can I just chime in here a minute? I just want to say that I am the one telling people that they were exposed to cases, and I am the one that's sending batches of people out to get tested after an exposure. And our department is the one that follows up with these people afterwards to see if they're positive or negative or if they've gotten tested. And I haven't had a single person report that they were unable to get tested. A lot of people are counting on those tests to get out of quarantine earlier. So, I haven't identified case study after case study that we have an issue with people not being able to be tested. And yes, it does give that false sense of security. Some people are using it for the wrong purposes. And I find they, like you said, Juanita, they really need that guidance to tell them when the test makes sense. Not just to, randomly go do it. So I echo what everyone is saying here on the board that, you have to have guidance to be able to do it appropriately for it to be effective.
And the other part of it too is that a test doesn't just involve coming in and getting a test. It involves the whole administrative demographic part of it first, and then the test, and then the biggest part is the follow-up. You need somebody to give them their results and explain those results, and it is not a simple thing at all. It's a process.
Yeah, absolutely. And just as a final emphasis and exclamation mark, $50,000 a day.
And that money could be well spent once the vaccine program starts.
We're going to need it. We're going to need it for something.
Given.
I don't know what it is. It could be for PPE when we have mass immunization clinics. It could be for the vaccine itself. It could be for boots on the ground. I don't know what to tell you it's going to be, but we're going to use it, and it's not going to be on testing.
We already had to buy coolers to transport the vaccine. You have to keep it cold. And these coolers are special coolers that have to be temp monitored, and they're very expensive, thousands of dollars worth of equipment,
Right.
even just to hold the vaccine when we get it.
Right. So just to, suffice it to say, everything's been very well thought out. I know that we don't disseminate this. This is our job. Okay. I'll try and get the word out as best I can, but as you can see, these are layers upon layers upon layers of information, that I can't possibly disseminate in a concise form to the public. So, I guess this is the best we can do. And thank you all for your input. And we're about 45 seconds away from going into public participation. If anybody has any other comments before.
Nope.
Okay. So why don't we go ahead, Pete, if you want to open it up, and anybody that has a comment, question, or concern, please address the board. And remember, it's limited to 15 minutes. We will end at 7, and each person has 3 minutes of time. So let's see if there's anyone there.
Yeah, Pete, Jim Adams, Counselor James Adams. I'd just like to take a minute of the board's time if I could.
Please do.
Yeah,
Jim.
first of all, I want to thank everybody for what they're doing. I had a phone call to the mayor the other day that was I had a question for him about the testing. It certainly got my answer, as I told the mayor, and I didn't follow up with Joe because I know you guys are busy. So I went to the mayor and I said, you know what, Mayor, the answer Joe gave you is good, is a great answer. That's all I was looking for. As you know, I'm in the thick of things on Broad Street. All your numbers that people are, that don't make it through this COVID, I am ending up with the majority of them. And I will tell you, there isn't one person who is frustrated with the health department or blaming the health department or anybody in the city for their loved one dying. So I wanted to make that clear to the board and to Joe. You guys are in the thick of things, and I am 110% happy with what's going on. I think, Joe, you couldn't have said it better when I was listening, and that's the only reason I kind of tuned on. It wasn't to, to come on here and say you're not doing a good job. It's basically to come on here and say you're doing a great job. I think what I'm hearing on my end is the people needing the information. I got more information out of tonight's meeting, and I'm glad I tuned in. And I know, Joe, your job isn't to, write up what's going on, but maybe if we could find somebody, because people in the public just want the information. And I think that's what they're looking for. And they come to me a lot because, unfortunately, I just happen to be there. And I don't have a lot of answers, but I certainly have a lot of answers just by listening to you tonight. I wish the whole community tuned in to hear what you had to say, because everything you said makes sense. I have a daughter who works at Mercy that is administering the dope, the vaccine. I have a sister-in-law who's a nurse in West Springfield, who's doing the contact tracing. So, and I'm the funeral home in town. So I'm right in the middle of the two. And I did talk to Deborah. I had a question for her last week, and she called me right back, just because I had a question on, when I might get the vaccine, which I'm not sure I fall in with the state, but it's not good. And I'm dealing with this on an everyday basis, but that's not here or there. But you guys are doing great. And there isn't one person who isn't happy with what you're doing. If there's anything you can do, is to get what you just said tonight out to the public, because I think that's going to take a lot of the questions, answer a lot of questions people have.
I think it's a great idea, and I won't speak for the board. So, but what do you guys think?
I'm fine with it.
Yeah, I think it's great. Get the information out there.
And I want to say, Councilor Adams, I did say previously, we have had nothing but support from the council, and I very much appreciate it. I'm glad we all are who we are right now. And so thank you for your kind words. And also, you know, as far as moving forward, this email that I sent out last night was not because of any pressure necessarily. It was just time. It was just time. I finally knew enough to be able to tell people that that where we are and where we're going. I didn't want to do that before because it was too much up in the air. So just so you know, I'll continue to do this. And if I have to be the guy that relays this information out to people one way or the other, again, the reason why I called the newspaper yesterday and asked them to do an article, I'll continue to do that. So we're not going to let that fall through the cracks.
Well, Joe, I appreciate that. And, you know, believe me, if it takes money, whatever it takes, I see what's happening with this pandemic. And if you guys need anything through the council or any other way, we'll make sure you get it, because you're doing the best job as you can. And the city appreciates what you're doing, Joe.
Thank you very much. I really, I appreciate that sentiment. Thank you. Anyone else?
Hi, I'm Kathleen Hillman. I live at 179 Susan Drive. And I want to thank Peter Coles, Karen Fanyon, Joe Rouse, Brett Bean, Don Humison, and Kristen Mello for allowing us to see the Zoom. It's really hard when you're listening just with the sound and not seeing the Zoom, because now I was able to see who was speaking each time. And that really helps me out because I can listen more intently if I can see who is speaking. Also, for those people who are hearing impaired, we need closed caption on this. And Joe, thank you so much for all of your information. It is really helpful to know the reason why you're not testing here. That is so important to me to figure out why. That $50,000 is huge. And I really think it should go for the vaccines too. And that information to the public would be so much of value to the individual people, especially I live on Susan Drive. We're a very close community up here. And there are a lot of retirees here, and they're all asking the question, well, why is Florida doing the vaccines? Why haven't we heard anything? So Joe, that information getting out in some way is so important to the residents here. Thank you for everything that you've done. I can't say enough about watching that contact tracing. I think that's really important. Thank you for informing all the businesses. It's really important that that information just get out. Thank you very much to everybody for allowing us to Zoom. And thank you, Peter, for putting this on YouTube, and the board for allowing that too, so other people can hear this meeting. Thank you.
Thank you.
All right. Well, yeah, definitely. Thank you for your interest. Did we talk on the phone?
Who, me?
Cassie? Yeah.
I think we may have at one time. I was
Okay.
at a couple of the health meetings for other things. So I've been when we were able to go to the meetings, I would go to the meetings. So I think you've seen me at meetings before.
Okay. Well, good. Thank you for your interest and your comments, and you know, we'll keep forging ahead, right? So
Thank you.
Is there anybody else that wants to? We still have about 8 minutes if anyone wants to comment or question. No?
Okay.
All right, great. So we'll wrap this up now. I just want to say that moving forward, when we have these meetings, I would advocate that, and it's up to the board to decide your personal preference. I actually do prefer Zoom and have the video ability, only because, and I guess we've gotten used to each other on a telephone conference, but sometimes it is nice to be able to read the other people and then kind of get a better sense of what's happening. I have no problem with that. There is going to be a meeting next week, and Pete, I know you're going to be part of that. So it's going to better explain the open meeting law or public participation moving forward. I think that all boards and commissions need to be on the same level playing field. The fact that our lines open tonight all of a sudden is not anything that I feel offended by. A little bit more so that I wished I had known further ahead of time. I think that this call-in information being released was that's something I at least feel like I should have been told. But that didn't happen. Anyway, moving ahead, we might see that, this is more of the norm where we are going to entertain public participation, which I fully support, by the way. I have no problem. I don't care if the governor says that we don't legally need to do this right now. I think it is very important to have that engagement with the public and the back and forth. Again, if there ever is an action item on the agenda where the board's going to need to vote, I will want to have public participation first in case something resonates with you that will influence your decision. Other than that, we'll keep it to what it is now so people can actually listen to what we have to say, maybe thereby answering their questions. So I'm done. I thank you all. Deborah, thank you for coming tonight. Cheryl, thank you for taking the minutes. Stan, Juanita, Margaret, you guys you're awesome, and thank you for your support and expertise.
Yes, you guys are awesome.
And
Thank you.
sometimes I said to Deborah, I had to have her here tonight because I said, we are in the thick of this thing. We're down in the trenches every day. Deborah, you need to hear the support that we have, and now we have support from the council. We have support from our board every month when we meet. This is rejuvenating for us. You guys don't understand how important it is, so that tomorrow morning, instead of waking up and dreading what we have to do, we feel like we're doing something for a good cause, right? I mean, this has been Groundhog's Day for 10 months. But when you hear your appointing authority, your supervisors encourage you and give you kudos, it goes a long way. That's what keeps us going. It really does. And so hopefully, Deborah, you got something out of that tonight. And again, like I said, we'll forge ahead.
And anytime either one of you are down and out, just give us a call. Any one of us. We'll keep cheerleading for you.
Absolutely. Think about this, guys. In just the last 2 weeks, more than 1% of the entire population of Westfield has tested positive for COVID in just the last 2 weeks. So,
Wow.
I think we'll look back probably at right around now as the deepest, darkest of the times. And you guys have your chins up and your heads held high. We're proud of the job you're doing. And there's light at the end of the tunnel. We just got to get through the next 3, 4, 5 weeks, I think. So keep up the great work, and you have our full support.
Thank you.
Thank you, Stan. Yeah, and I agree. There is a light at the end of the tunnel. And man, I'll tell you, the staff that we have and the way that I've said this before, the way that we pick each other up, when somebody's not really in it to rise to the occasion. Our staff members, everybody that works in the health department is supportive of each other. And we can see, I told you before, just from the looks of somebody when they are just done, they're down and out. And these things that we do, I'm trying to really steer the ship to, we can't give up now. We've gone too far, and we're still working on it and moving ahead. So all of that positivity, and it's wonderful. We don't get that occasion very often. So these are, I never really dreaded board meetings necessarily. I always felt like stressed, maybe a little, and pressured that I was going to say something stupid. But now I look forward to it because I know you guys, we're all singing the same song, and it's really nice to hear.
Well, keep up the good work.
With that,
With that,
We are in under an hour. If there's nothing else, then I will hand it over to the chair if she wishes to convene.
okay. Once again, with deep gratitude for the amazing job you guys are doing. Keep in touch with us. We're always here, and we will adjourn at 18:59.